Okay, hello everyone. Hello everyone here in person at NYU IPK and everyone who's been waiting for us at IPK Remote, where we spent most of the last 2 years. This is a thrilling moment for us here because it is literally the first time that we have assembled in person at 20 Cooper Square on the 5th floor in 2 years. And those of you who are IPK regulars know that this is something we used to do several times a week, with scores of people and lots of fanfare. And it's hard to believe that we've been away for so long, and it's just fantastic to be here. So welcome to all of you who are here online, but I hope you don't mind me discriminating against you and offering my preferential excessive welcome to those of you who are assembled here in what is actually a full house at IPK. It's a physically distant full house, but it's a full house nonetheless. And we hope to see all of you who are in the screen world back here soon. So I haven't introduced myself for those of you who are here for the talent, but I'm Eric Klinenberg. I'm the director of IPK and a professor of sociology here. And tonight we have assembled to talk about one of the many things that we have all lived through and struggled with over the last couple of years, which is the crisis in providing care, care to the people we love, care to the people we're concerned about. I don't know if we'll talk about how we've taken care of ourselves tonight, but probably most of us have neglected that too. It turns out it's a lot of work to live through a pandemic. And the reason we're here is because when we do that work of care, not everyone's equal. Not everyone does the work equally. And we want to spend some time tonight trying to explore why. And there's some very obvious answers to that question. And I think there are also maybe some surprises. And maybe some of the things we experienced were unpredictable, or maybe some of the things that we experienced are going to take us to some different place. And so we thought about who we could invite to spark that conversation. And we really lucked out because two people jumped to mind. And they're both sitting next to me right now. First, we have our first IPK visitor in 2 years, Jessica Calarco, professor of sociology at Indiana University, who really emerged in the last couple of years as one of our sharpest, most insightful public voices on the questions about what was happening in our families, in our domestic lives, especially around gender when it comes and parenting when it came to COVID. She has done a remarkable set of scholarly articles and also has been an active presence in the media and on social media, just consistently making intelligent points and pushing the conversation further. So you've ruined my thesis that Twitter is destroying the American mind by being so good there. And then I thought, well, who would be great to have in conversation with Jessica? And immediately Katha Pollitt, kind of legendary feminist scholar and thinker, poet, writer, columnist, happens to be a neighbor of ours here. And I reached out, and Katha, to our great delight, said yes. And so I'm going to engage the two of you for about half an hour. And then I spent some time over the pandemic with one of our terrific doctoral students at NYU, sociology, Michelle Cera, who is going to jump in and join the panel and talk about some research that she's been doing and provide yet another perspective. And then we'll open it up to questions. So as always in these Zoom events, we'll take your questions online. Feel free to use the function on your Zoom screen, and we'll find a way to get the questions to me. And those of you who are in the room, you also get to ask questions and use your voice. And it's great to have you here. And it's also kind of wild to not be wearing a mask. So yeah, doesn't it feels kind of good? Can I say that it feels good? Okay, I'm going to admit it. All right, let's jump right into things here. I actually decided to start with a really big picture question, and I'm going to start with you, Jessica. And the question is, what do you think at this point are the most important things that we've learned about ourselves from these last 2 years?
I mean, when it comes to pandemic and caregiving, if we're focusing on that realm of things, I think what we've learned is that without good incentives, behavior won't change, and that the incentive, that the inequalities that we saw before the pandemic, we shouldn't have expected to see anything different than a continuation or an exacerbation of those, given the fact that the incentive structures weren't changing in terms of who was incentivized to work, who was incentivized to put their own needs ahead of others. And so I think it was, to me, this is a story about broken incentives, and how we need to, if we want to change the inequalities and things like caregiving, need to restructure who is in a position where caregiving matters, and in a position where they are not incentivized to put themselves in a position to benefit from the exploitation of others when it comes to caregiving as well.
Katha?
I think that's a very good way of putting it, because it doesn't blame any individual people like one's husband. It's just, we need better incentives. I think one thing that was happening before the pandemic is that people have an idea that feminism, as a friend of mine said a long time ago, it's in the drinking water. It's just happening, and people get these ideas and life changes.
Oh,
And that does happen.
Pardon to interrupt.
Sorry.
Can you turn the mic on? Is it on?
Oh, no. Yeah, isn't it?
It's on.
Yeah. It's green.
Perfect.
Just bring it to your
mic. Okay. That these things sort of happen automatically because people get ideas in their heads, and that does happen to a certain extent. But there's also the fact that men still make more than women. So who is it logical to step back when both people can't work? Well, it's going to be her, because she's making less. Who is the person who's been socialized from birth to be the warm, generous, nurturing, caring person who learns to babysit when they're a teenager? It's her. He's out moving furniture, which is also a useful skill. I think that what the pandemic has taught us is how shallow that those changes were, and that when you take away the structure of school, daycare, babysitters, grandma being able to come over and help out, I mean, whatever people had to help out with the childcare, when you take that away, it's just her. It's just her. And that is very discouraging to me.
Let me say that I was surprised a little bit that you led with incentives and stayed on incentives, because I think of this part of the social sciences that emphasizes incentives above all is our colleagues in the economics departments. Katha said something about socialization and the kind of deeper roots of this. Is there more that you would add to incentivization?
Yeah, I mean, certainly I think the incentives and the socialization are linked together in the sense that there's no incentive to change the way that we are socializing young people, for example. If the rewards for men in the workplace are greater than the rewards for women, if we don't have things like affordable childcare, then we're still going to need someone to stay home for the children. And so I think it's about thinking about the way that those two things are linked together, the way that our social structures are reinforced by the cultural norms that we have, and that there's very little reason to change them if we live in a culture where white cis men are kind of at the top of the social pyramid, and they benefit from being able to exploit the caregiving labor of others within that system. Then I think it's really hard to push for a change in the way that we socialize young people, just given the way that's set up. So I think certainly that the socialization matters. The culture obviously gets inside people's heads and shapes the way that they think about things, but there's also larger structures that push that kind of socialization and make it seem logical to people, as Katha was mentioning, in terms of whose work is more valuable in our current system, and how does that lead us to lead couples to make decisions and feel like they have agency over those decisions, when really it's a set of structured choices that make sense to them and that they can feel justified in making. Do we call that culture? Do we call that structure? Is that something in between?
It's probably a naive view, and I guess our experience bears out what a naive idea this is, but one could imagine that, you are living your life and a pandemic hits, and suddenly your workplace closes down and school is no longer available. You can't socialize with your neighbors. You maybe don't want to leave your home. And you experience that, if you're part of a family, as a social change, to use a concept sociologists like. And one could imagine in a world that when you experience a social change that's that profound, that it would be the occasion for a conversation about what we should do now. You know, if you're living in a family and there's care responsibility, or if you're living in a home that you're sharing with someone else and there's work to do, that before you went around and started doing stuff, you might just talk about a plan. And Jessica, you have done a lot of empirical work where you surveyed mothers in Indiana over the course of years to see how their social lives changed over time, how their work changed over time. And you've also done a lot of qualitative interviews, listening to people's stories. And I know you have an account for this, but it just strikes me that one of many arguments for why there's so much inequality in domestic labor is not just that men are paid more, but also that men tend to be out in the office and can make a claim that they just don't know what's demanded at home. And so here we were in the pandemic, and there was a social change, which could have been the occasion for conversation. And men who are ordinarily blinding themselves to the reality of the domestic situation would presumably have a very difficult time not seeing just how much work it takes. One could have been optimistic about the possibility that there would be a reset. So could you tell us a little bit about what actually happened?
I mean, unfortunately, a reset was not what happened, in part because, and your work speaks to this too, Eric and Michelle. I mean, I think within the home, couples were able to physically distance themselves in ways that exacerbated inequalities. I talked to one couple, for example, a highly educated professional Latino couple, where both partners were working pre-pandemic, and but she was already working part-time, in part because when the kids were born, she didn't have access to paid leave, and so she took some time off and then went back into kind of part-time work, while he kind of stayed in the workforce and kind of kept moving up the career ladder. And so by the time the pandemic hit, he was already earning more than double what she was making. And so they had one kid who was in elementary school and one who was in childcare. And when things closed down, they didn't even talk about it. We just said she said it was just me by default, essentially, in this idea that and I asked her, kind of pushed further, like, well, how did you come to this decision? And she's like, well, whoever makes the most wins. And it was just this idea that because of these huge inequalities, and then meanwhile, he would quite literally go up to their bedroom every day and lock the door while she was downstairs trying to do her work while also keeping the kid on Zoom school and trying to entertain a toddler. She told me this one story about how early in the pandemic, this is where she decided to cut back her work hours. She was trying to read a report for work and she was trying to nurse her son at the same time. And he kicked over a cup of tea on her desk and the tea went everywhere and the baby bit her in the process. And she was just like, I was crying and he was crying. And it was just this entire mess of a process. And but they were physically in a space together. And her husband, meanwhile, was just not seeing what was going on because he was up in the bedroom all day and was able to do that in part because they could justify that given the inequalities. And also, I mean, that was the case even for couples where they both continued working full-time. It was often, this was another kind of pattern that we saw in our data, was that dads in particular, in part because they'd had less experience with childcare and had less faced those kinds of demands to be the full-time care provider, got frustrated more often with their kids. And mothers, in part because of those caregiving norms, often felt like they had to step in to protect kids from dad and dad from kids, not necessarily in terms of a physical abuse kind of a situation, but just wanting to step in and be the barrier in an emotional sense when those frustrations were getting particularly high. And that took a huge toll on women. But in the process, it allowed men to then make the decision to say, well, you know what, maybe it's okay if I go back to the office. And so disproportionately, as the pandemic continued, it was dads who opted to go back into the workforce or back into the office as soon as things reopened. Well, moms were the ones who were disproportionately saying, no, I'm going to keep working from home, or I'm going to shift back to part-time work so that I can be home more often. So there was, even despite these potential opportunities to see more, I think it also made dads simultaneously realize how difficult this is, but also still have an out to be able to separate themselves from that.
Katha, would you add anything?
Oh, I'm so depressed.
The second half of this panel is going to be so uplifting.
Oh,
Let me
good,
tell
good,
you.
good. I can't wait. Come
Big
on,
plans for
Michelle.
us.
Cheer us up.
Stephen and I are going to clean the table at the end of this.
Well, you know, I everything everything that's been said speaks to how deep seated these things are. And I think I would add one other thing, which is even when the woman makes more, which was the case for my mother and my father back in the 50s and 60s. I mean, there were always couples like this. She still does the bulk of the housework and the childcare and everything like that. And my father worked at home. He was a lawyer and he practiced out of our home, but it was still on her. And after my mother died, my father said something so moving. He said, I never realized how much work she did, even though he was there. I mean, you cannot see what you don't want to see or what just is not in the picture for you. And I'm a little bit sympathetic to that because I'm the person who doesn't see the mess. I was looking at my apartment today. I think there are books everywhere. How did this happen? You know? And I just say, well, I'll think about it another time. Let's just leave the book. I've got something else to do. So I have a little bit of sympathy for people who are not super into housework. But can I just tell one story?
Of course, yeah.
Okay, so I was just doing a little bit of research for this. And on the BBC, there was this amazing article. And it was about how in Sweden, they now, you can get a huge tax deduction for hiring a cleaner. And this is something that is very good for the cleaners. And it's very good for the people who employ these people, but it is mostly used by more prosperous people. And some people think, well, why should the government be paying someone to clean your house? That seems kind of weird. But the reason they did it was because women were spending more time on the housework and they thought this would help. And it did. It did. If you have a maid, it really helps. And one of the things that happened during the pandemic was that the people in the social classes that had access to that kind of help didn't have it anymore. And then you can paper over a lot by hiring help, by going out to eat, especially before you have children. After you have children, you realize what bullshit that all was. But it really helps to be able to hire people to outsource domestic chores. So Sweden has decided to help you do that. I don't think that will ever happen in this country.
So you've anticipated a question I was going to ask. It oftentimes is the case in American kind of popular culture or public culture that someone can spend years doing really careful research on a topic and write lots of peer-reviewed articles, books, and no one reads any of it. And then they have one perfect line and it reverberates everywhere and you find yourself all over the place. And that happened to Jessica over the pandemic when she said, I think in an interview or maybe in something maybe it was a Times op-ed piece I think you wrote, other countries have welfare states. The United States has women. And I want to ask you both to speak about that. And then maybe we'll go back to what Katha just said about Sweden to ask what else happens in other welfare states that Americans might not be aware of.
You want to go first?
I mean, be careful because you're on the stage with a man, so I'll just jump in and start saying my own thing. No, I'm just kidding. I don't care. Either.
Okay, I'll start. Actually, you start. I've just lost my train of thought completely.
I mean, I think to me, what jumped out at me during the pandemic in terms of doing the research that I was doing, following women who I had been following for almost 2 years before the pandemic, was how much the loss of access to social support systems left women to do a disproportionate share of the labor, and how even with the woefully insufficient social safety net that we do have in the US, that when we even lost access to those things, when we lost access to public schooling, when we lost access to kind of other types of even access for families that were accessing like Medicaid supports or supports through WIC, for example, that those were disrupted in important ways during the pandemic. And really all of the extra work in the absence of those kinds of social support systems fell to women in almost every household that we talked to. And I think it really spoke to this idea that rather than step in this moment of crisis to say, how can we meet people where they are? How can we make sure that their needs are being met? Instead, there was just this assumption that they'll figure it out, and the they'll figure it out, the they there was women. And that's long been the case. Whenever we kind of step into moments of crisis, it's often women who are expected to pick up the pieces to find ways of making it better for themselves, for their families, for their communities. And I think that to me was the best way of kind of conceptualizing that, in terms of not to deny that women in many other countries do a disproportionate share of the caregiving labor, but rather to acknowledge that our systematic underinvestment in the social safety net has had huge consequences in terms of the gender inequalities that existed before the pandemic, and that certainly have been exacerbated by it as well.
I want to connect that to the absence of a safety net in so many areas of life. I mean, it's really not rational to think, well, we can have, universally funded daycare while we don't have national health care, and while we have so many failing public schools, and we don't have after school, et cetera, et cetera. I mean, it's all like part of a whole worldview that not enough people in this country have, which is that the government is there to help. That was the thing, remember, when Ronald Reagan said the most terrifying, however many words in the English language is, I'm from the government and I'm here to help you. And he won the election. There are a lot of people, and I bet there are a lot in Indiana, a very red state, who just don't think it's the responsibility of anyone to help them, except maybe their church. I mean, that's different. And so that gives, the very conservative, important social institution in this country a real in, because they've been providing a lot of these things. The big mega churches, you can go there for all kinds of things that in other countries government will help you with. So I think it's really changing those incentives. That is really hard when, even something like food stamps. Oh, I saw somebody at the store buying lobster with their food stamps. Those people don't really need it. They're just, ripping the system off. People believe that. And maybe once they did see somebody buy a lobster with their food stamps, or their friends saw it, and, whatever. So it's really a whole mentality that has to change. And I don't really see how that is going to happen, given the way politics are going now. I mean, look what happened to the Build Back Better Act. We got the Infrastructure Act, and that's a lot of jobs for manly men. But the Build Back Better Act, that was the softer side, didn't, Joe Manchin said, he said, oh, well, who are these people? They're just, it's sort of like you shouldn't have children if you can't afford to take care of them. A lot of people believe that, especially when the children are Black. That, it's one thing if it's a widow, someone who followed all the steps, but not if it's someone they feel is lazy and who is not producing children of value. So,
Katha, you've spent years writing about these debates. Are we in a different place than we were when you started?
There used to be a welfare rights movement back in the 70s. And that's, just like welfare itself has kind of disappeared, the welfare rights movement has kind of disappeared. I don't think that there is a woman-centered grassroots movement around women and children. There are websites and there are organizations, but I don't see it happening at the grassroots level to anything like the extent it would have to make a difference. Am I wrong about that? Yeah.
No, I don't think so. And I think it comes in part from the way that our society has become increasingly unequal in other ways, on a class and race perspective as well, in the sense that our lack of a social safety net, certainly it advantages men over women, but it also advantages people at the top of the ladder in terms of people who are able to afford the sort of private social safety nets that they can use to weather the storm, and also allows them to, I would argue, preserve a sort of moral, getting back to the stigma that you were mentioning before, to preserve not only a resource advantage over people at the bottom of the ladder, but also a sort of moral advantage in the sense that they can portray, if you are someone who can get by without a social safety net, you can perceive yourself in our culture that celebrates personal responsibility and the myth of meritocracy, then you can perceive yourself as a better person, as a more responsible person. And that's why, I mean, one of the things that I'm talking about in a new book project that I'm working on and that I find is that even those families that are far below the top of the ladder, families that are even have maybe are eligible for food stamps or eligible for Medicaid and are deciding, you know what, we can get by without it because I don't want to be that kind of person who has to rely on the social safety net. And I think it gets at the way that we have chosen to underinvest in this in part because of how it allows us to maintain the deeply unequal structure that we have. And so unless we change the deeper seated inequalities, the deeper seated racial inequalities, that the systemic racism and the sort of capitalistic driven economic inequalities, then I don't think we'll get to a place where we will ever be willing to invest in a better social safety net because it makes it too easy for the people at the top of the ladder to hoard the resources and to feel justified in doing so.
If I could just say one more thing, because I hear the voice of my friend Heather Booth, political organizer since the 60s, speaking and saying, no. She would point out that we almost did get the Build Back Better Act. It was two people that prevented that from going through. And that's part of the peculiarities of our, constitutionally mandated nutty system, that people from these two minor states were able to just deep six this whole thing that, all the other Democrats and the president really wanted. So sometimes I feel there are a lot of people who understand that too many people are left out, but there aren't quite enough of them. And my fear is that after November, there'll be fewer in government because things are looking kind of hairy at the moment.
In addition to almost getting through Congress, the Build Back Better bill had overwhelming popular support,
Yes.
right, throughout the country,
Yes.
but not where it counted. And so there are those political structural issues that are real obstacles, and we haven't even gotten to the Supreme Court, which we probably won't discuss tonight. Disasters and extreme events oftentimes are useful to us as observers because they make things apparent, right? They express and make visible things that we kind of take for granted and don't pay much attention to. And so they're nice resources for social scientists to see the world. And oftentimes that's the case. We had profound gender inequality in domestic labor before the pandemic. The pandemic just pointed it out to people who weren't looking. Sometimes a disaster changes things. And in fact, our behavior shifts, or we recognize that the thing that we are experiencing is wrong and untenable. And we start a conversation about change. And we're still in the middle of the pandemic, so it's hard to know exactly kind of what comes next. There's good reason to be cynical about the structure of American politics, but it's not at all clear that we know what the political aftermath of this will be. I mean, for instance, I don't think a lot of people anticipated that the United States, which is so stingy with welfare in general, would become so generous when it comes to the economic stimulus for working people, for renters, as long as it has been. I mean, the poverty rate went down in the United States during the last 2 years because of federal largesse. That hasn't exactly happened for care at the domestic level, but I do wonder whether there have been any social changes you've observed in your data or in your journalism or policy ideas that you didn't see coming, and are there any reasons to feel like the story's not over yet?
Well, New York State is, because some good things are happening in some states. Like New York State has this 12-point program about care, about childcare, and making it easier for women to work. So that's good. And we have a Democratic-controlled legislature, and we have everything is Democratic in New York, at least for now. So that's all good. And I think other, good things are happening in some other states too. And I mean, Oklahoma has pre-K. They've had it for quite a while, and you wouldn't think that. You think Oklahoma, they're so red, but they do have that, and so there's always hope. It's just that the task is so enormous, and the pieces have to all come together in a way that is not easy to imagine. But that doesn't mean it won't happen. Maybe it will happen.
Are you seeing anything on the ground in the families you study?
Not a lot of hopeful things, unfortunately. I mean, I think what I've seen is a weakening of trust in institutions, a weakening of trust in public schooling, for example, a weakening of trust in kind of political institutions, a weakening of trust in sort of science-based institutions, that I'm worried about the implications on that front in terms of more parents pulling their kids out of the public school system, or more parents being willing to push back against the public school system. I mean, I think there's, and certainly a lack of trust in science when it comes to things like public health initiatives and sort of a questioning of media messaging. I think there's a lot to be worried about on that front. In terms of, I mean, where I do see hope is that I think what we've seen during the pandemic is proof that money works when it comes to changing, and when it comes to changing people's lives and changing people's circumstances. I talked to one low-income Black single mom, for example, who when she has a son who was about 18 months old at the start of the pandemic, and she had never really been able to spend any time at home with him. She didn't have access to paid family leave when she first had him, and went back to work almost right away. And the stimulus money that she got, coupled with things like rent relief and utilities relief, allowed her to stay home with him for the first time. And she's like, she described it as sort of the happiest moment of her life as a mom, in terms of being able to finally kind of have time. And so I think we don't want to sort of, I'm reluctant to push too far in the direction of, we just need to make sure that nobody has care responsibilities, or that we outsource everything, but that people are able to engage in care in a way that they feel supported in doing so, and that they're not necessarily pushed into those arrangements. And I think, to me, that highlighted how much money can change people's circumstances. And certainly that didn't last all that long for her, but it was something that I think showed how powerful it is to have access to the resources that you need to be able to make the choices that are best for you in the moment, and how often we deny that to people, particularly people who are in kind of systematically marginalized groups.
Great, thank you. I want to at this time call up Michelle Cera to join the conversation. I'm going to give you my seat. I'm going to hand you the mic in just a second. So welcome. Michelle, I guess what I'd like to ask you is to talk a little bit about the research you did, the interviews you did. You were specifically interested in trying to understand how this kind of structure of domestic care got instantiated and sustained when you might have imagined it coming under pressure as everyone's eyes were on the home and people were around. So tell us a little bit more about what you did.
Yeah, so first, thanks for having me here. So what we did was we did a couple study. We interviewed 20 couples for a total of 40 people. And we were really perplexed because, as Jessica alluded to earlier, and Eric as well, the pandemic could have been a time to reset gender inequality, because for the first time you had both parents in the home. And of course, this is for parents whose jobs afforded them the ability to work from home in the first place. But for those couples who both parents were at home for the first time, we're like, okay, well, both parents are home, therefore splitting up domestic labor such as laundry, cooking, cleaning, childcare could have been 50-50. Why didn't that happen? Why did almost the opposite occur? Why did inequality deepen? And what we found was this gender inequality really manifested through the physical and symbolic division of space. So one really interesting couple, one that was particularly memorable for me, we talked to the father, and he was like, before the pandemic, I would go into my office about 8-9 a.m. I would come home around 5 or 6 p.m. And then during the pandemic, his wife told us, and he told us as well, he would just go into their bedroom and he would close the door, and his wife was like, yeah, the door would be closed till 5 p.m. But I saw him after 5 p.m. And so you see this kind of physical distance between him while he's doing his work and focusing on his career and everything else that's going on in the domestic sphere. And so his wife then was responsible for being in the shared spaces, the living room, the kitchen, spaces like that, where she then was available for care. So whereas her husband was just completely physically separated and unavailable for things that came up, she was doing the bulk of the domestic labor. And being in a separate physical realm is also symbolically or signaling to others, I'm not available for this care. I'm not doing it. Another story, which Jessica, one of your anecdotes made me think of, was another mom who described herself as this octopus. And so she had like one hand doing her paid labor, her work. She had another hand doing the laundry. She had another hand helping her child with Zoom school, another hand mopping the floors. And she was like, I just can't do this. And so several moms actually cried throughout the interviews with me because they described it as this like zombie apocalypse where they're responsible for all of this stuff at once and operating these shared spaces while this expectation was just not there for men. And yeah, and of course there were significant costs that we also discuss in this paper that Eric and I are writing together in terms of mental health, in terms of career advancement, also in terms of their relationships, both with their kids and relationships with their partners as well. So the consequences are numerous, and that was pretty devastating to hear about.
Well, as you're speaking, it reminds me that we are in the midst of this transformation in the way that we work also. And our work shifted to fully remote for professionals who could work remotely. We should emphasize throughout this conversation that for a great number of people who were deemed essential, even though they weren't paid as if they were essential, they continued going to work physically. And in fact, I think people in your research, oh, thank you, Sam. In people in your research, many of the women who were working as essential workers came home to find that they had the Arlie Hochschild second shift remaining for them. But we are, in the midst of this transformation in how we work and where we work. And I wonder if any of the three of you have heard discussions about what that potentially means for the nature of domestic labor and the division of labor. And Michelle, maybe you're part of a set of conversations that Katha and Jessica don't know about.
Yeah, I mean, I think that working from home can be a double-edged sword in this weird way where it affords you flexibility to be with your kids and spend time with your kids, which is one thing that kept coming up in interviews, which was a helpful change. But it also then means that you have to be more responsible for domestic labor. So I think going forward, some of these changes that we're thinking about could potentially be helpful absent some gendered expectations. So we have shift in the ideological cultural realm about who's responsible in the first place for taking care of the kids and for doing the laundry and things like that. It could potentially be a really great thing for moms where they can simultaneously be working mothers and be working and be mothers at the same time. And I think that is something that came up, but absent incentives for men to stay home and to take on more domestic labor, it's hard to see how much things will change.
Can I ask a question? Did you find that there was a lot of, one question one might ask is, well, why don't the women just lay down the law for the men? Why do they let the men get away with it? So what about that?
Well, I think this is also something you found in your research, Jessica, is that the conversations just did not happen. I would ask, well, how did you come to this? How did this division of labor play out during the pandemic? And they were like, well, it was just natural. That's just how it happened. It's just how it occurred. And a lot of times the conversation was entirely absent. It was just expected that the mothers would take on this work.
That's interesting because my daughter and her friends who have an email chain called the Coven, they're so conscious of emotional labor, and there's some other kind of labor, that a new kind of labor, I forget what it's called, but they're measuring everything in their head, and it's in a way that in my generation we didn't have the concept of emotional labor. You didn't have the idea like I'm the person who has to remember Or I'm the person who always has to do the Christmas cards. I mean, you just did them. But people seem now, at least in a certain social class, seem much more drilling down into what it means to be responsible.
Well, I think that's what was surprising, because the people we interviewed were in the New York, New Jersey area, which are typically progressive people, right? And you would think that this population itself would be more awake and understanding of emotional labor and other things like that. And yet we still found that that gender inequality deepened and manifested through this division of space. So I wish it was the case that things were changing. That's just not what we found. I think Jessica, you want to comment?
Yeah, I mean, I think one of the things that we've noticed in our research is in part that at least when the women that we've talked to, even if they're kind of progressive women, they still don't want to think of their partners as bad partners or bad dads. That there's kind of a desire to at least create the perception for themselves as much as for other people, that their partners are good partners, that they're doing. And I think for a lot of women, when the rubber met the road during the pandemic, they realized that their partners may have fallen short of that, but didn't necessarily even want to believe it themselves. And even those who were willing to believe that their partners, and were willing to call out their partners, at least in interviews, not necessarily to their partners, for not doing enough, often had a lot to risk by leaving those partnerships, in part because of how unequal their partnerships were in terms of access to money, especially if they'd step back into part-time roles and were dependent on their partners for health insurance, for example, that made huge risks that came with kind of threatening that partnership or making too many demands of dads to do more. And so I think there was definitely a hesitance both on the side of like feeling like you've made a bad choice if you then decide that your partner isn't being a good partner or isn't being an involved enough parent, for example. And then also, at least for some of the couples that we've talked to, especially women who were in very precarious positions, those who lost their jobs during the pandemic, which happened to disproportionately women, especially those who were working in sort of essential worker or outside of the home type of roles, and those who were in part-time labor really had a lot to risk by leaving those partnerships during the pandemic, unfortunately.
I remember 10, 20 years ago, I don't remember exactly the date, but there was this kind of a spike in critical literature about the care crisis. I remember Arlie Hochschild writing about this. So Deborah Stone, there was a whole series of books and public debates about the Barbara Ehrenreich, wrote about this partly. Care is not just about, taking care of the nuclear family. The care extends in many directions. One of the professions that experienced the highest mortality rate and also the highest incidence of COVID cases during the pandemic are health aides and nurses. And the nurses experienced a kind of moral injury that was really acute from being celebrated in public as heroes, in the beginning, at least, but also knowing that they were placed in impossible work situations and that they weren't actually performing the level of care work that they would like to be performing because they were overwhelmed by conditions. We've reached a moment. We have more old people than ever before in the United States. We have more people who are aging alone than ever before. We have young people with real mental health crises. It seems to me like the debate about who provides care and how we provide care and under what conditions and with what resources should be at the center of our conversation. And I might not be looking in the right places, but I don't hear it in the way that I think I used to. And so I just would like to ask the three of you, am I not hearing it because I've turned a deaf ear, or is it happening in some place? Have we turned to other issues? What happened to the debate about care?
I mean, I think to get back to Katha's point about outsourcing care, I think part of the problem is that we've made this into a market, and that the people at the top of the ladder can afford to pay for care, even though oftentimes what that means is exploiting women, particularly low-income women of color, in the process. But that means that we don't have to have a public conversation about it when the people who are kind of able to pay for house cleaning, are able to pay for childcare, are able to pay for meal delivery, are able to pay for kind of all of these things, then we don't have to have a big conversation about it. And especially with how unequal society has gotten, the people with the power to change things are disproportionately the ones who can afford to pay for those kinds of services for themselves. But that means that there's less incentive to have these big public conversations about the necessity of care on a collective level, beyond just what individual people are negotiating for themselves. I don't know. For me, at least, that seems to be one key factor.
There's another thing too we haven't discussed, which is that a lot of women aren't having kids now, or they're postponing it and postponing it and postponing it. And this is, from what I hear from younger people, this is part of it, is that you just look. My daughter, when she was thinking of having a baby, she said, but everything I read about it is just so awful. And you think, is this what I'm signing up for? Nobody talks about how wonderful it is to have a baby. It's always, and then I couldn't do this, and then I couldn't do that. And it's very discouraging. And I think a lot of people are just saying, well, forget it. If that's really what it's going to be like, I'm not going to do it.
Michelle, you can have your sociological hat on or not. I wonder, in your conversations with people your age, generation, education level, Brooklyn, what is the conversation like about expectations from relationships, about having children? Do you share that kind of cynicism about the process that Katha shared?
Yeah, I mean, I think the conversations are very much present among people our age. In fact, it's like all we seem to talk about, especially during the pandemic, is gender inequality and racial inequalities. And these conversations are on social media and they're in person as well. But I don't think the conversation can change the structure, if that makes sense. So just for a funny anecdote, one of the couples I interviewed were self-described communists. And they were like, we have these conversations about exploitation, about domestic labor all the time. These are our firm principles. Yet when it came down to it, she told him, hey, you're stealing my domestic labor because I'm doing all the laundry, I'm doing all the cooking, I'm doing all the cleaning. And he went out for work. He worked for the MTA. And so because he was making more money and because he was, providing the income that sustained their household in the first place, there was nothing she could do. So yeah, the conversations are there. We're having them. They're very present in my mind, in the minds of people. I think my age, it doesn't change what needs to be changed, which is our political and economic structures.
All right, we are going to move to questions. And the three of you can ask questions of each other. The audience that's here in the room can ask questions. Those of you who are watching on Zoom, please send us messages as well. Feel free to, are we using the chat function or the Q&A function? Use one of the functions on the phone and it will, on the Zoom, and it will get transferred to me. I got my computer open. The first question that we got concerns the role of the media in all of this. And there's a question here about, whether part of the blockage in the United States is that our media system tends to be so conservative that it pays little attention to this. It does not raise this as an issue, or in your do you have the perception that maybe there is a brewing conversation in some quarters that that could be pushed out?
And jump in on that one. So one of the topics that we've been studying with our pandemic research, one of the surprising things that came out relatively early on was that a lot of the parents that we talked to across the political spectrum actually were just not, these are parents of young kids, were not all that worried about their kids getting COVID. And part of that came from the early pandemic media messaging, which suggested that kids were at low risk of contracting, transmitting, and getting seriously ill from COVID. Now, I would argue, and have done some pretty extensive digging into this, that a lot of that messaging was geared at getting kids back into in-person school and childcare because that was good for the economy. And so we can argue about why there would potentially be an incentive for media companies and others to promote that kind of a messaging. The consequence of that, though, was that it made many families feel very secure sending their kids back. They sort of wanted that, especially moms who had taken on the sort of disproportionate share of the caregiving, latched onto that message. And really kind of bought into this idea that, okay, kids are low risk, so I can send them back to school so that either now I can go back to work or I can go back to church or I can go back to all of my pre-pandemic activities in terms of feeling safe and doing that, even if kids weren't vaccinated yet. And unfortunately, that has led to the same parents who bought into those early messages are also disproportionately not planning to vaccinate their kids and has kind of undermined interest in seeing these kinds of steps as necessary. And so I use this as a case to talk about how powerful media messaging can be and how oftentimes that media messaging is working in the interest of larger economic forces as opposed to in the interest of individual people, and how the consequences of that can be to, I mean, I don't know if that particular set of messaging worked to exacerbate gender inequalities, but it certainly shaped the kinds of decisions that families were making in consequential ways. And so I think it points to this role that media messaging more generally, and kind of the fact that like the care crisis just dropped off the map as a thing that got, I mean, it got a lot of attention media-wise early on, but then really just kind of fizzled out and wasn't the story of the day anymore. And once that sort of, I would say once we got past like December of 2020, that just wasn't really something we were talking about anymore. Once some schools started to reopen, once some care centers started to reopen, it sort of became, okay, now you just make this choice to send your kids back, or you just make this choice to hire a nanny or figure out a way to get through it, but we should all be back in person now. And that was sort of when things seemed to just drop off the map.
Katha, do you want to add anything on media angle here?
Well, you know, the private schools in New York City stayed open. And if I were a public school parent, I would think, why do those kids get to go to school and mine don't? Maybe the people who thought the schools should reopen and all that, maybe they were right. I mean, I don't know. I'm not anything like up to date on all of this, but there's so many different ways you can see it, so many different forms of privilege can take, because now those private school kids already immensely educationally privileged, or even more so. And the kids who in New York City have been out of school or back and forth endlessly for 2 years, will they ever catch up? I mean, the kids who really need to be in school and whose parents cannot provide, cannot make up for what they're missing. So I think it's really complicated. And it was interesting what you said about not vaccinating their kids. I mean, that is just so sad, people not getting vaccinated, and ivermectin and all of that. And that's when you realize there's a kind of deep craziness in this country. There just is. As William Carlos Williams said, the pure products of America go crazy. It's really true. I shouldn't be saying this.
Michelle, you
be quiet now.
Well, no, Michelle, you on this theme, Michelle has spent the last year or so, maybe more, doing research on alt-right social media. You're especially interested in the conversations about politics, and I think COVID came on your radar in the last couple of years as well. Are there things you learned following those conversations about gender or care that are useful for this conversation?
Yeah, I mean, I just think on the topic of media in general, we have to ask what media, and I think we're living in an increasing age of being in silos and separate spaces. So if you ask me how much time I spend listening to CNN, MSNBC, Fox, like never. My media is very segmented and different, specific to what I'm particularly interested in. And I think that's the case for the people that I've spent time with over the course of the past 2 years. I've interviewed maybe 70 to 100 alt-right folks online, and because their access to information is so different than other people's, their conversations are just entirely different. And so they'll be more likely to believe things like we were talking about earlier, like people on welfare buy lobsters, and that's just what they have access to. And so it depends who you are and where you are. So if you're not watching CNN and Fox, and instead you're on 4chan, 8chan, MeWe, etc., and that's where you're looking, you're probably going to be learning things that are anti-feminist and things like Joe Biden is a reptile. And so that's your information. It doesn't really push the envelope very much.
Any questions from people in the room? Yeah, Fabian, why don't I bring you a microphone?
Thank you so much. I'm Fabian Holt. I'm a visiting scholar at IPK. This is a fascinating panel, and I really appreciate your presentations and the conversation. I wonder if you found any examples, or did you meet any women who objected or sort of put their foot down? And the other question is sort of related. If if they expressed their frustration publicly and started building sort of networks or solidarity?
In terms of my own research, I mean, I think in terms of, there were women who were able to avoid these patterns. And in most cases, they were women who already had partners who were disproportionately involved before the pandemic. I interviewed one mom, for example, who's a nurse practitioner, and her husband was already the primary caregiver for their daughter before the pandemic. And he was only working about 10 hours a week doing like art restoration on the side. And they had made that decision because he was earning so much less than she was to begin with. And so that pattern had been in place for years, and they kind of continued that during the pandemic. She did pick up more of the housework than she had done pre-pandemic, just because she felt bad about how much more he was doing with her working long hours at the hospital. But at the same time, they did have a pattern that looked very different than others. In terms of women pushing back, it was actually more common, at least for me, to see women pushing back on the health decision-making front than on the childcare front. I talked to one couple, for example, a Black couple that both were working in fairly low wage jobs before the pandemic. She was able to work from home as a customer service representative, and he was working outside the home in construction. And they had 3 kids and then had a 4th baby during the pandemic. But he was very anti-mask wearing, and she was very worried about the kids getting sick and herself getting sick. And so that was a constant source of stress for them, that he didn't want to wear masks, and she was very insistent on this. And they ended up breaking up during the pandemic. I mean, she was doing a disproportionate share of the child care too, but their fights more often centered on the health stuff, in part because that was, I mean, it seemed like that was a thing that they felt that she felt more comfortable taking a hard stand on, because he had to leave the house to go to work. And so that wasn't something that felt like a fight that could be had, but having a fight about you're going to work outside the home and you're not wearing a mask, and then you're coming home and you're potentially putting us all at risk, was a place where she felt more comfortable sort of speaking up, and their relationship, at least to this point, hasn't survived that. But I think thinking about where women may have grounds to push back, and the gender stuff may, at least in this moment in time, not be the place where a lot of women feel comfortable speaking up, but that there may be other places where that comes out instead. Yeah, great question. Thank you.
Yeah, I think it's a really great question. One thing that surprised me was talking to women who, instead of talking to their partners about all their grievances and their stress, created networks on Facebook, for example, with all of their complaints. So some of the groups they were in had thousands and thousands of mothers in there talking about all the difficulties that came with the pandemic. And one mother even quit her job to run this network because the Facebook group had become so big, and they got sponsors for advertising. And so they were talking all day about how bad their lives had become during the pandemic. Did that translate into changes with their partners themselves? Not so much in their own words, but it's not to say that pushback isn't there. It's just in other spaces.
Hi, thank you so much for this. I think it's really a wonderful thing to hear you kind of reflecting on all these processes that have been like foundational for all of our lives in the last couple of years. And so I have so many questions. I've been like shifting around about which one I wanted to ask, but I'm going to kind of try to make a point and then ask you a question about it. So each of you is kind of locating the source of possible change around the state, and kind of identifying the kind of limited, to put it in mild terms, welfare state that we have as being responsible for the gender inequality that we all have experienced in such an intense way. I think we could also flip it around, right? And to say that the vast gender inequality that we experience, and particularly the family as a kind of foundational unit for American social organization back at least until the revolution, is in fact responsible for the limited welfare state. So the question that I want to pose is kind of like, okay, so how do we get around this? Like, we can't argue people into the idea that we need a better welfare state, like, or at least not immediately. Maybe we did almost get the Build Back Better Act. But the question is kind of how do we create the change maybe from the other end? Like, and Katha, you started to mention that in the 70s, there was a bigger movement around women and children's rights, which was really robust and kind of hopeful. So I'm wondering where we might dig in.
I've asked a lot of people this question: where is the activism among mothers and women? And the answer I usually get is people are too tired and they're too busy. I don't know if that's true. I mean, another part of me thinks, well, people always have time for the things they really want to do. You know, people go to the hairdresser, people watch a lot of television, people go to church. Why can't they do this? I think I don't really know the answer. Maybe you have something to say about that.
Sure. Yeah. I think on the other side of things, what's needed is more community care networks, mutual aid networks. And I actually have some friends who are now raising children with their friends. So instead of this nuclear unit where it's like mom, dad, kids, it's like, well, on Tuesday, you're going to be with this friend. On Wednesday, you're going to be with this friend. And I think that if we think about different family structures, then we can start to change some of this gender inequality. And I don't know how widespread that is as a phenomenon in general, but it's definitely something I've been thinking about myself. And I think it's part of the conversation of my generation of how we can switch things to at least make some progress in this realm.
But one thing that complicates it is the growing and very large number of single mothers. And if you're a single mother, you don't have the problems we've been talking about, except, I mean, unless you're partnered, but just not married. So you don't show up in statistics, but everything is on you, everything. I do not know how those women survive. And people who do this voluntarily, I have several friends who, are reaching the crisis point in their reproductive possibilities, who are going to do it themselves. And I want to say to them, do you really know what you're getting into? But I think they probably do. And they've just decided, no, I've really got to do this. But with so little help out there, I just really wonder how people manage. How do they manage? So what you're describing would be great. Yeah, it would. I'd sign up to be a grandmother.
Someone can pass around the list. Rowan, do you want to jump in?
Just want to join the chorus and say thank you. Much appreciated. I'm Rowan. I had two very brief questions that I hope are related. One is anecdotal, and I hate being the person who has a question that begins with an anecdote. But your question is, this entire conversation is making me think of something that I saw on the train on my way here today. I've very rarely been taking the train for obvious reasons, but now that we're back, I took the train to the office. And when I got on the train, there was a young couple who got on and they were unmasked. A young couple, mid-20s or so. The gentleman got off the train, and then the young woman put on the mask. And here I found myself realizing, because someone came and said to me who had a mask on, they said, the kids don't care about us. They don't give a fuck. Look at them, right? So they were virtue signaling in one way. The virtues aren't my virtues, but they were virtue signaling one way. I feel like you're always doing that on the subway, basically, right? If you don't wear a mask. But then if I didn't see this woman, except when she was without her partner, there would be a different type of virtue signaling that's happening, or self-care. And I was just wondering if the three of you had noticed or can diagnose this type of siloed, I don't know if it's virtue signaling or self-care. It's self-care in a sense of, I'm with my partner and I want to show that I have an ideological, synergy with them. but at the same time, it's self-care in other ways. So I was just wondering about that because it made me incredibly sad and angry. And then I had a question about Indiana, because if any of you have done any touring or junkets around Indiana, you know that Northern Indiana is incredibly different from Southern Indiana. And the people who will tell you that are the people from Indiana. And so I was just wondering if you got this sense in your research as well of that split. And because in New York, we tend to say Indiana, but once you're there, it's so segmented, right? And I just wondered if that came up and if you'd speak about that as well. Thanks again.
Yeah, absolutely. And so most of the qualitative work that we've done, well, it started with couples recruited from Southern Indiana from prenatal clinics back in 2018. And so some of them have moved elsewhere since then. But I think it is a very, Southern Indiana at least, is a very politically divided place in the sense that, so like Bloomington, where Indiana University is, for example, is almost 50-50 in terms of Democrats and Republicans. And if you step outside of Bloomington, it's much more Republican even than that. It is the blue bubble, but a barely blue bubble in a very red area, which is very different from Northern Indiana, particularly areas like Gary that are closer to Chicago that lean more in that direction, places like South Bend even, which is a little bit more mixed. So I think there's certainly variations across the state. In terms of the gendered mask wearing stuff, that is something that came up a lot in our interviews. And disproportionately, women were the ones who were taking more steps to keep their families safe and put a greater insistence on things like mask wearing, especially early in the pandemic, and things like hand washing. And they became sort of the health police within the family. And certainly this is not a new phenomenon, that women have long been the sort of health managers within families and the ones who have kind of faced with the expectation to keep their family members safe. What this meant, though, when there was a disconnect between men and women, that created a tough choice, though, because couples, what we found in our research, they didn't want to fight. And so women in particular wanted to avoid conflict with their partners. And so oftentimes what that meant was, especially for women who were in positions kind of relative to their partners where they were sort of either financially more precarious, more dependent on their partners, or were just kind of in a situation where they didn't have as much power within the household, that often meant giving in to what their partner wanted, at least when their partner was around, and then maybe making different choices when their partner wasn't there. So maybe when their partner was around, they would make one set of choices, kind of exactly like what you were talking about. Some women kind of went a different direction, tried to persuade their partners otherwise, or a lot of them ended up just kind of doing the work of managing household safety on their own and just kind of letting their partner do their own thing. And so I think it speaks to the idea that there's a number of different ways that this panned out, but there were a lot of conflicts within couples, and that led to, in the interest of keeping the partnership together, avoiding that kind of situation that I talked about before with the couple sort of breaking up over this, that it often means sacrificing, usually, and in the cases where it was reversed, where the man was the one who was more insistent on health stuff, even in those cases, it was a little bit more mixed. But in general, the person who was more health conscious was often deferring to the less health conscious one, and kind of giving in and saying, okay, I guess we don't need to take it as seriously, even when that ended up sort of putting the family at greater risk in the process.
So we have been promising for the last couple of years that our events will be 1 hour, so that all of you on Zoom who have domestic care responsibilities can go and do them. If you're a young person watching on Zoom, wear a mask when you're on the subway. Come on. And for everyone, thank you. What a thrill it is for us all to be together. We have more coming. I know is it April 14th, Marie, we're doing a book launch for Marita Sturkin, and lots more to come in person. Fingers crossed if everything stays like it is now and we can be safe together. It's great to see faces, and it's even great to see a few masks too. Let me end by saying thank you to this terrific panel, Michelle Cera and Katha Pollitt and Jessica Calarco. We really appreciate you re-inaugurating IPK. And with that, I'll say good night.